That's right, folks. We're out here at Primary Care Plus, your doctors for life at 3010 Holiday Drive in the Algiers Plaza Shopping Center. And I got to tell you, if the energy out here today is like this every day, this is the place you want to be for sure. And we are very fortunate. I was always jealous of Tommy Tucker's interviews with Dr. Brent Wallis. He calls him Dr. B. Can I do that as well, Doc?
Sure.
So I'm going to call him Dr. B as well. Always enjoyed those interviews, and there's so much great information that y'all provide about just, the daily rigors of life in the intersection with health, right? And it's just kind of an eye-opener.
It's great discussions, actually. Tommy's a lot of fun to work with, but hopefully those are messages that are getting out to people that, really helps them.
Absolutely, absolutely. So we want to talk today about Primary Care Plus and what that means. This facility was originally out in Gretna, and y'all decided to move here into Algiers. Couple of great doctors that will be here, Dr. Vockroth, as well as Dr. Megan Butler, and we're going to be talking to Dr. Megan Butler next in the next hour here. So tell us a little bit about why Algiers.
Yeah, sure. So we had been in Gretna for quite a while. Dr. Vockroth has been with us for nearly 10 years, and the corridor we were on is kind of heavily traveled, but also heavily populated by clinics. A lot of opportunities for people to go see the doctor over there. And when we looked at the West Bank region, we saw a major absence in the Algiers area. We saw, there's a handful of clinics over here, but really the people in the Algiers area either have to drive over to Gretna or they've got to cross the river to get their care. And so we had an opportunity to relocate this clinic, bring along with it Dr. Vockroth and over 1,000 of his patients who were really excited to have this new location here. And I think it's really exciting, too, to be a part of this economic rebirth in the Algiers area. There's a lot of activity on the corridor, a lot of new building going on, a lot of new shops coming in, so we're glad to be a part of it.
I saw a lot of rehab of older buildings, too. Very busy over here right now.
Yeah, definitely. I mean, the minute you get off the bridge, you see the cranes and all the work they're doing on the canal itself, and but then all the development that's happening really down the street. So, for us, it was really a no-brainer. This is an area that really needs more health care. It needs easy access to care and neighborhood-type care because people are more likely to go see the doctor if it's convenient and close by. And we have a lot of parking at this location. It's centrally located in Algiers, so we really think this is going to be a great place to deliver care.
All of those things are obviously very important: ease, convenience of administration, getting to and from. I guess when you're putting together the model, you like to see that because you want to remove barriers, right, from people coming to the doctor. Not that they don't all love you, Dr. B, but sometimes they just don't feel like coming to see the doctor.
Yeah.
Right?
I mean, if you can make it easier, that's definitely better. And nobody really likes going to the doctor per se. We hope they enjoy coming to see us, but if it's convenient and easier for them, then they definitely are more likely to come.
So let's talk for a moment. Primary Care Plus. Why? What's behind that?
Yeah. So Primary Care Plus really began over 10 years ago, and we started out as just a standard primary care clinic, but really over the years we looked at how care delivery really affects the population, and what we can do to not just help the individual, but really help an overall population improve their health. And so what we did is we took a look at standard primary care models, which are very driven by visits. Come in and see your doctor, you get what you need, you leave. You come back and see your doctor over and over. What we wanted to do is we wanted to make it more of a holistic experience where you have an opportunity to meet with your doctor, meet with the nurse practitioner, meet with our care teams, which are RN nurses, and really talk about things beyond your health. So things that maybe affect being as healthy as you possibly can. and really kind of addressing all of those issues beyond just blood pressure control and diabetes control. So that's what we were trying to aim for.
You know, in dealing with that situation with my parents through the years, they'd often come home from the doctor, and I'd say, well, did you tell them this? No. Well, did you tell them that? No. Did you tell them this? No. Well, why? Because that's not the doctor that actually deals with that. But it seems like in this model, this is.
Yeah, definitely.
Because y'all want to know, you want it to be holistic, and you want to be the pathfinder for them if there are other services that they have to get.
Yeah, we want to know everything that's going on with you, so we don't just treat one ailment. We work closely with all the specialists in the area. Over here on the West Bank, we have a lot of relationships with specialty care as well. But what we want to do is we want to make sure you understand what's going on, and you may have experienced this. I know I have. You go to see a specialist, you're probably in the room for 3 to 4 minutes. You get a bunch of prescriptions, and you walk out, and you're like, what happened? You know? And so when that does happen to you, what we try to do here is not just care for you and address the things that we directly treat, but also to look at where else you've been and say, okay, this is what they wanted you to do. Are you doing this as well? So we're really trying to package really holistic or all-inclusive care into that model. Healthcare is confusing, I mean.
You have to work at it, right?
Mm-hmm. Yeah, it's definitely not easy. And if you've ever had to care for your parents,
yeah,
just like you said, they come into the doctor. They may say things, they may not say things, and then they leave and they have no idea what they were told quite often. And so we include the families in all of these discussions. We do a lot of outreach after the appointments. We actually connect everyone with one of our care managers who's an RN that's going to be calling you on the phone and talking to you. Did you take your medicines? Did you go see this doctor? Did you get what you need? And if you didn't, how can we help? What can we do to kind of break down those barriers for you?
Yeah, I mean, I can recall certain situations where we come home with a multitude of prescriptions and, what's this one for? I don't remember. I don't remember. I don't remember. And it's always nice if you have that kind of running tabulation sheet with an explanation of what each one,
mm-hmm.
Is for, and
Well, and it's more often than not, and I think what frustrates me, what has always frustrated me in medicine is when you go to see a doctor, a lot of times you may have heard them say, "Oh, well, I didn't prescribe that." So you're going to have to talk to that doctor about that medicine. And none of us should ever do that. I mean, we go to school for a really long time. We know what all of these medicines are for. We may not initiate that treatment, but we certainly know what that treatment is for, and so we should be able to explain it to you as well. We have a lot of patients in the New Orleans area that have very complex medical problems, and so they do need to see a lot of specialists. So we know that that's going to happen, but they also need somebody to help coordinate all of that care.
EMR, electronic medical records, has that helped? Where now, I remember 25 years ago, it was, I might get these records by carrier pigeon. I don't mean to make light of it. But with the new EMR systems, and we're getting a more robust day by day here in this community and other communities around the country, has it helped?
It's better. It's not where it needs to be. I tell this story all the time, but you remember 20 years ago, you could only get money out of the ATM that your bank owned.
Right.
Now you can go across the world, stick a card in, and get money out. But if you go to a clinic down the street, they have no idea what your health problems are.
Right.
And we've got to break down those barriers even more. What we have been able to do is we've been able to create good technological connections to the electronic medical records within this area. So we usually can kind of tease out what's going on with you. The other piece that we had to layer in, and eventually we'll solve this problem too, but is just, labor. It's, we have teams that actually are calling and trying to get those records and sifting through them, and our physicians spend a lot of time prepping for appointments, understanding everything that's going on with you. So they try to do it with a complete picture rather than focusing just on that one problem you may be there for.
And in advance of the appointment.
Mm-hmm. Yeah, and really the way a lot of people ask us, how do we do that? And I'll tell you, anybody who's gone to a doctor, it's like a hamster wheel. It's see a patient, see a patient, see a patient. We don't do that. The time that the doctors spend learning about you, reading your records, calling your other physicians and figuring out what's going on is as valuable as the time that they spend with you face to face. And so what we try to do is we try to really make sure that they have that time to be prepared for that appointment so that they can actually address all the things you need. They should never really say, you only get one problem today. I've got too many patients to see. I would rather space everything out so that they can spend all the time they need to.
I love using the football analogy because that's the game, right? When you're there, physician, patient, that's the field of play. And what you've just described is all of the preparation in advance of walking out on the field.
Exactly. Yeah, and our doctors, we tell them this all the time, they are the quarterback.
Yeah.
They may not do everything. They may not, run up and block and do all the other things you have to do, but what they should know is everything that's going on, and they should know who to get in touch with if they don't. So that's really critical, is kind of that connectivity piece and really enjoying doing that. So the doctors that we employ, too, they really enjoy that aspect of care. I said it today when we were cutting the ribbon. Our physicians I asked them, I said, what's the one thing you want people to know about you? And they all said, I like to talk a lot. And I said, well, that's perfect. It works out good because we know our patients like to talk. And so it's a really good mix. You get to sit down and really, get to know what's going on with them in every aspect of their life.
And how often in your practice, just through putting people at ease, do they reveal something that was really important that they have not revealed, at that point in time, that just kind of is said in passing?
Mm-hmm. It happens all the time, or it may be something that in casual conversation you're having that maybe they didn't realize was important. We're always looking. I always joke, but I can kind of look around the room and I can do an exam on people without touching them, because you kind of know what's going on. And so our physicians are all very well trained in that they understand to be looking for certain clues, but they really want to develop those relationships with their patients. That's really what's critical.
So when you're talking about like a family practice doctor, internal medicine doctor, are there characteristics that y'all are looking for? Because you see it all, right?
Yeah. Oh, yeah, definitely. Yeah, and it's a little different. Doctors are weird. I say this a lot, too. We did what we did for very specific reasons, but what's interesting is as you interview and you build your medical staff, you actually pull out very specific characteristics that would make them successful in this model. The typical model where you're, kind of, like I said, running on a hamster wheel, seeing as many patients as possible, they're not going to enjoy this. They're not going to really enjoy sitting down, getting to know their patients. They want to keep moving.
They're what we call dragnet, right?
Exactly.
Just the facts, ma'am.
Yep, exactly. Tell me what's going on. I got to get out of here in 2 to 3 minutes. So we are looking for very specific personality types. I think the people that we found are attracted to this model because they want to spend that extra time. They want to go home and they want to feel really good about what they did that day.
Yeah, that's refreshing to hear, right? Because separate and apart from healthcare and in other types of businesses, they almost move away from that very quickly if times get tough.
Exactly.
And it seems in medicine when times get tough, meaning, you have sick people, and we've just into finishing up our second year of this pandemic that has stretched, I'm sure, all of y'all's assets and resources. You learn things about people too, right?
Yeah, it was, you mentioned the pandemic, and that was a fantastic experience. It was terrible, obviously, but it was really interesting to see how people pivoted, what they were able to do. And we only shut down for probably a week and a half. And the doctors said, I got to get to my patients.
Yeah.
I've got to get in. And so, we immediately started telemedicine. And they started connecting. We had several days where our doctors just literally picked up the phone and called people to check on them and see how they were doing. And it was really refreshing to see that commitment and that dedication. Other places people may have said, well, I don't have to see patients. I'm going on vacation.
Yeah.
And they didn't. They jumped right in.
Isn't that great? All right, we're visiting with Dr. Brent Wallis, Primary Care Plus Clinic Medical Director. If you have a question, 504-260-1870 on the Oakland Heart Jewelers Talk and Text line. We will be right back after the break. Stay with us, folks. We are back, folks. We're at the Primary Care Plus at 3010 Holiday Drive in Algiers Plaza Shopping Center. Your doctors for life. Doc, on the text line, if I come to primary care, do I see the same doctor or just who's available?
No, we try to make sure that you see the same doctor every time. We do have the ability, though, to do same-day and next-day appointments, and so in that case, occasionally you'll get who's available, but that's also going to be talking to your primary care physician after the appointment. So.
And do they take insurance?
Yeah, we do. We actually take pretty much all major insurance, and we do see a large number of patients that are Medicare or Medicare Advantage, but we do also take commercial insurance as well.
All right. Yeah, there you go. So one of the things that you say is kind of a driving force here is a policy perspective, right, of that y'all refer to as social determinants of health. Mm-hmm. So tell us about that.
Yeah, so, when we look at our patients, we're really trying to look at the whole patient. And that's a lot more than just what medications you're on or what surgery you've had or what your diagnosis is. There's a lot of things going on socially with our patients that need addressing just like their blood pressure does. And so we have created a program, we call it our Comprehensive Wellness Program, where annually what we try to do is see a patient. It's really run by our nurse practitioners who are fantastic clinicians. They spend an hour plus with our patients and actually do a head-to-toe exam, figure out all of their medical problems, screen for what's called social determinants of health. And, that's a fancy medical term for things that we all know about. It's people maybe who are having trouble with their housing. Maybe they're afraid they're going to lose their home. People who are having trouble getting food. We know that that's been a major problem. But it may also encompass other social issues, maybe things that are going on at home, difficulty with your spouse, really anything that affects your ability to focus on getting healthier. We want to try to address that in our social determinants program as well.
Because one thing we know is that individual stressors in one's life tend to reveal themselves in a lot of the things that you are looking at as a physician.
Exactly,
right?
Exactly. Yeah, I mean, if you're anxious or very depressed because of your home life situation or social situation that's going on, you're less apt to actually take your medicines as prescribed. Depression and anxiety actually affect most medical problems. They can raise your blood pressure. They can cause problems with your diabetes. So you really have to treat the whole patient in order to get the outcomes that you're looking for. So that's why it's just as critical to understand all these other things that are going on.
Interesting about this, people go through phases in life, and you might not have always been with this housing, food, home issue challenge, right?
Mm-hmm.
I mean, because the composition of your family may have changed, other ingredients may have changed. You may have been one that was able to take care of yourself, had a good job. Things happen. Companies go out of business. Mm-hmm. Your 401k goes away. You're relying on Social Security. You're in a home that you can't afford to keep up any longer. You have to find alternative housing. So a lot of people find themselves could have major changes through these phases of life.
Yeah, definitely. I mean, you can go for a very long time, especially our younger patients, and not have too many of these issues. As you get older, they tend to become more prevalent. And certainly during the pandemic, we saw a lot of this. We saw a lot of people. There was a lot of issues exposed, I think, when suddenly a lot of the safety nets were eliminated. And so this really is when we started building out this program to figure out how can we help. If you think about it, if somebody has what we call food insecurity, so they're not sure where their next meal is coming from, and you're trying to treat them for diabetes, well, they're going to eat whatever they can get. Yeah. And that's going to make their sugar go up, and ultimately that's going to result in complications of diabetes, and those could be heart attack, it could be losing your leg. So that's critical. That's stuff that has to be addressed. And so our care teams are really focused on identifying what those issues are and then making sure they get you some help. And it comes in a lot of different ways. We have great resources in Southeast Louisiana. The problem is there's so many of them, it's trying to figure out how to navigate them.
Yeah.
And an individual patient getting online or picking up the phone book, if people still do that, it's very difficult to figure out where to go. How can I get this? They may not be able to get there to actually get the help. So we try to break down all of those barriers for you.
And I bring it up in this context because I think sometimes people are very judgmental and predisposed that, you started out with these challenges, you live with these challenges, you're ending with these challenges. And I find just quite the opposite. And it could simply be that you raised your children, you educated your children, you made a better life for your children, and now they're living in some other part of the country, and you find yourself here alone.
Mm-hmm. Yeah, it's more frequent than you would think, and some of the younger people over the last really 10-plus years have left the New Orleans area, and their parents don't want to leave. This is everything they know. It's all of their friends, but as you do get older, unfortunately, your friends, pass away. Your spouse may even pass away, and so suddenly you may find yourself in a situation where you don't have the support network that you used to have. And it's not through anything that you did, it's sort of a natural evolution of what happens over time. And so identifying what those needs are, it can sometimes be difficult because people sometimes don't want to talk about these things, if you imagine, when was the last time you went to the doctor and they talked to you about whether or not, you could pay for your housing? Were you afraid you were going to be homeless, And so they may not want to have that discussion with you, and I think that's why it's so critical to have the relationship with your physician. I say this all the time. You should be able to tell your primary care physician absolutely anything. There's no judgment in it. We just want to know so we can help.
Yeah, because as you get older, there's no doubt that stressors play a much more prevalent role in your health.
Mm-hmm. Yeah, a lot of people don't realize how important it is, but mental health is just as important as physical health, and one really plays on the other. So anytime we have patients that are depressed, we almost universally see worse diabetes control, worse blood pressure control, worse cholesterol control. And it comes from a lot of things. When you're not motivated, you may not take your medications, but you may also eat more poorly. You're not exercising as much because you don't have the energy to exercise. And so it cascades and actually can really present a whole lot of problems.
Of all afflictions, is diabetes one that is more influenced by environmental influences and conditions?
It's one of them. Many of them are, actually most conditions are influenced environmentally. Diabetes in particular is one of the worst we see, and it's so prevalent. 30% probably of the individuals in New Orleans have diabetes, and it's affected by so many things. Lifestyle is critical with diabetes, and a lot of people don't realize it, but diabetes can be silent for a very long period of time before you develop all those complications. So really having a great relationship with your physician, making sure that you're being screened for disease is just as important as being treated for disease, because if we find it early, we can usually address it.
A lot of folks dealing with challenges of pharmacy benefit managers, and I know along the lines of diabetes, it's a real challenge. Is that something else that your care team helps manage in this primary care plus model?
Yeah, certainly. Pharmacy is a big issue. Cost has been going up just dramatically over the past 10 years. And so what we do, we can't control what the pharmacies are doing, what the benefit managers are doing, but what we can do is we can know what's happening, and we can make sure, for example, that we're not prescribing a medication that someone can't afford. It does no good to give somebody a medication that's going to cost them $500 if they can't afford the $500.
Right.
So we've got to be looking at alternatives, and then our care managers, another piece that they do is, they do look for financial assistance for medications if they are absolutely necessary. They try to help the patients on that. They also look, it's interesting, there's a lot of patients that may be eligible for additional assistance and didn't even realize it because the system is confusing. And so we're also looking and saying, okay, did you know you qualify for this benefit as well? So they're really, again, doing a top-to-bottom evaluation of what the patient needs.
Yeah, I kind of chuckle when you say that because I sat on a hospital board for 24 years. And I think the first 3 years of being on that board was just trying to figure out the nomenclature or the lingo of medicine. Because there's an acronym for everything,
there
right?
is,
I mean,
yeah.
It's just, I'd sit there and listen to these presentations, and it was one acronym after the other. And at some point in time, I developed an acronym chart just so that I could stay up with the conversation.
You almost need a whole dictionary.
Yeah, exactly, just to stay up with the conversation, right? I mean, and it was all relevant information, but it's hard. And then when you're not in it at all and you're not used to hearing it at all, and it gets presented to you in that way, it's really hard to digest it.
Yeah, definitely. One of the things we do here, I think, really well, we work very closely with our physicians, our nurse practitioners, and our care managers to make sure that they understand exactly what you're saying. You're not talking to another physician. You're not talking to another healthcare individual. So our practitioners are very good at explaining things to people in ways that they will understand and doing it over and over because they don't always listen on the first try. And so one of the things we try to encourage, too, is frequent visits. The really good thing in health insurance right now is that most primary care visits don't have a copay associated with them. It's not universal, but most of them don't. And I think that was one of the best things to happen because that means you can come in and see your primary care physician whenever you need to. So we encourage them, if you have somebody that maybe isn't understanding what's going on, they need a little bit more time with you, bring them back in a week, bring them back in 2 weeks, so that you can continue the conversation and build that relationship with them.
So at Primary Care Plus, you don't have to apologize for being the cheerleader for your health, right?
No.
Because you need to be the advocate for your own health. You need to take control of that and be the biggest cheerleader for your health.
Exactly. And, and the piece that drives me nuts sometimes is, physicians don't always explain what they're doing and why they're doing it. And that's a big tenet here is that anytime you're writing a prescription, anytime you're ordering a test, the patient needs to know exactly what you're doing, what you're looking for. They should be informed. There's sort of this old thought in medicine, the doctor's always right. That's not always correct. And so really
you guys are fallible?
We are fallible. We definitely are. And my wife will tell you that quite often. But no,
She must be my wife's sister.
Yeah. You really do. It's a partnership, and that's the piece that I think people have to understand is that your primary care physician is there to help you, but you're doing something for them as well. You're making them appreciate their profession. They're enjoying what they're doing, and so it really does have to be something that you do in conjunction with each other.
Now, your clinics as well utilize, which I think is a great service, nurse practitioners. Is that correct?
We do, yeah.
And NPs in Louisiana, we've kind of been a little bit late to the game, I think, as opposed to other states. But when it's done well, I find that that's a unique value.
Yeah, it works great, and I will tell you, our NP staff is incredible. They are extremely intelligent. They're every bit as good as all of our physicians are. But the piece that we do, I will tell you, so we assign a primary care physician to every patient that we see. And we do not assign primary care, or we don't assign patients directly to our nurse practitioners because we consider them a critical part to the entire healthcare team. So you're going to get to know your nurse practitioner just as well as you know your doctor. So that way you've got kind of, two people that you can go to if you need to. What's interesting, too, is our nurse practitioners run our after-hours call service. So, and they always have a physician as backup if they have any issues, but you can actually get in touch with them 24/7 to talk to them about anything you may need. But they really are a critical part of that
Do
team.
they serve a dual role when they are as a navigator, too?
They do. They help a lot in the navigation. All the NPs have gone through nursing school. Many of them have actually extensive nursing careers. ICU-based, hospital-based, or out in the clinics and everything. So they've seen
it all.
Yeah, they've seen everything, and so they a lot of times will initiate, addressing a lot of these issues. But what's really nice for them as well, because they've got so much to do on the acute care side, the chronic care management side. We've got a great team of RNs that's our care management team that really handles the majority of those things.
All right, folks, we're visiting with Dr. Brent Wallis, Primary Care Plus Clinic Medical Director. That's where we are today at 3010 Holiday Drive, brand new facility. Primary Care Plus, your doctors for life, right out here in the Algiers Plaza. You want to come by, visit the facility, see what you're missing. I could say that right off the bat because it is really, really nice. And all the folks here, they have a smile on their face. That's nice, too. We'll be right back after the break. Stay with us. We are very excited, folks, to be out here at Primary Care Plus, your doctors for life at 3010 Holiday Drive in the Algiers Plaza. Easy to get to. Y'all have a lot of parking out there, so that's never going to be a challenge here. So that was great to see that out there. Doc, we covered a lot of territory this morning, and it was all great. Final thoughts?
Yeah, I mean, this has been wonderful, actually, and we're excited to see all the people that came to this ribbon cutting. I think the kind of final thought for me, for anybody that's listening, everyone is a patient, right?
Right.
And I think it's critical for everyone to understand how important their health is and that their primary care physician, like I said, should be a partner in that health. It's really something you can't do on your own. We can't force you to do it. It's really got to be a partnership, and I think we have really built something exciting here. We have a wonderful staff that actually understands that tenet, and so we're hoping that this is really going to take off.
Absolutely. And if you have a minute, I want to tell you about this pain in mail, but no, I'm just teasing.
Anytime.
No, but thank you so much for joining us today. We're very excited to be here. And, y'all have left nothing to chance here with the facility. I mean, it flows great, adequate space, comfort level for the patients. All very important things.
Yeah, this is a wonderful facility. We're super excited to have rehabbed a building here in Algiers. Like you said, there is parking galore. There's shopping in the area as well, so you can make it a day. But the facility is really, truly beautiful. Everybody's so excited to be here.
Good deal. Congratulations to you and your team as y'all continue to expand Primary Care Plus presence, footprint in the city and greater New Orleans area. And we appreciate that investment for sure because it means a lot to the health care of our citizens.
Yeah, definitely. Like I've said, we're across Southeast Louisiana already, 8 clinics big. More coming soon.
Absolutely. All right, that's Dr. Brent Wallis, Primary Care Plus Clinic Medical Director. We will be right back after the break, folks. Stay with us.